Joo. Lauri WhatsApp use. Okay, I will English. Okay, I will speak in English. Okay, I will speak in English, and it will be better if we show the text of my. I sent this PowerPoint to Rebecca. Cause if the pronunciation somebody can't understand which I will talk, they can follow the text on the screen. So I will continue. I will now continue. Epilepsy is a chronic disease. The clinical manifestations of which can be both convulsive seizures and various mental disorders, and is the object of study of clinical disciplines, neurology, psychiatry, and neurosurgery. The history of studies on epilepsy and mental diseases counts many centuries. Vast bank of clinical and psychological the history of studies on epilepsy and mental diseases counts many centuries. Vast bank of clinical and physiological data has accumulated. Paradigms related to etiology and pathogenesis are changed. However, a general theory combining and explaining this data has not been developed yet. Researchers of various profiles keep suggesting new theories and hypotheses striving to interpret various demonstrations of epilepsy and mental diseases to unite them in a single concept. Hypothesis. A hypothesis is suggested by us in relation with metabolic mechanisms of pathogenesis of epilepsy, in respect of which several clinical manifestations of epilepsy were reviewed. Among them, the phenomenon of forced normalization in respect of which several clinical manifestations of epilepsy were reviewed. Among them, the phenomenon of forced normalization of electroencephalogram image, EEG. According to the hypothesis, epileptogenic substances are constantly accumulating in the brain of an epileptic patient, and when reaching the threshold value, cause a seizure. In addition, epileptogenic substances during epileptic activity in the brain undergo metabolic transformations required for their removal from the body. If the concentration of epileptogenic substances in the brain fails to reach this threshold value, they cause weak epileptic activity, most reflected in epileptic bioelectric phenomenon, typical for the EEG pattern of interictal period. Moreover, certain parts of epileptogenic substances apparently drive out interictal epileptic activity of the brain, or in other words, part of epileptogenic substances is released during interictal epileptic activity. Now let's consider some clinical manifestations of epilepsy in the light of this hypothesis. We have reviewed the following clinical manifestations of epilepsy from the perspective of this hypothesis. Cases when prescription of anti-epileptic drugs is associated with improved electroencephalographic pattern, but with the deterioration of the clinic and frequent seizures, are observed in practice of epileptologists. The drug change leads to the opposite result: improvement of the clinical picture and the EEG deterioration. According to the hypothesis, the given clinical manifestation of epilepsy may be explained as follows. In the course of interictal epileptic activity of the brain, parts of epileptogenic substances are released, as a result of which the threshold concentration of the given biogenic amines is slowly accumulated and reach the maximal value within a longer period of time. Thus, time intervals between seizures grow in proportion with the intensity of epileptic activity of the brain during interictal period. By prescribing certain anti-seizure medications, it may be achieved that the cell neurons will not be responsible for epileptic activity at sub-threshold concentrations of epileptogenic substances. However, the seizure will still develop if the concentration of epileptogenic substances reach the threshold value. In such case, in terms of absence of epileptogenic substance released through epileptic activity of the brain during interictal period, their accumulations up to the threshold value will be faster. Seizures will develop more frequently. However, interictal EEG pattern will improve. In case of appropriate, in quotes, successful selection, in case of appropriate, successful selections of anti-seizure drugs, if improvement of EEG pattern, including its normalization, known as forced normalization of electroencephalogram, as well as improvement of clinical condition, including total elimination seizures, is achieved, the patient often experiences psychogenic discomfort to the extent when, in order to get rid of it, he or she stops administrations of medication, thus provoking a seizure. When explaining the given fact by forced normalization of electroencephalogram, it should be noted that the anti-seizure drugs are selected so that neurons are exhausted or blocked and stop responding by epileptic activity at this threshold, at this threshold as well as sub-threshold value of epileptogenic substance concentrations. The given biogenic amine accumulate in the brain, which is manifested in psychoneurological disorders. However, the seizure provoked by the patient himself or herself removes epileptic substances, which improves mental health of the patient. Previously, Bayes had proposed to name the phenomenon when the prescription of the anti-epileptic drugs is accompanied by an improvement in the electroencephalographic picture, but with a deterioration in the clinic and an increase in seizures, and the change in drugs leads to the opposite result, an improvement in the clinical picture and the deterioration in the electroencephalographic picture, by term clinical electroencephalographic dissociation, in short, clinical dissociation. But then we saw then even earlier, Weiner and al. Proposed to name the phenomenon observed in neonatals in which the clinical component of a seizure occurs from time to time with or without an electrical correlate, electroclinical dissociation. One must think that the further development of epileptology will open up new varieties of disparity between the expressions of the clinical and electroencephalographic pictures, manifestations in patients with epilepsy. Therefore, we think that it may be better if all types of disparity between the clinical and electroencephalographic picture in epilepsy will be called. Offer the previous also electroclinical dissociation, and provide them with an abbreviation such as magnetic resonance imaging has this abbreviation MRI. For example, electroclinical dissociation, ECD, and additionally specify what type of disparity between the severity and the clinical and electroencephalographic picture they refer to. Then the phenomenon described by Weiner and al., in which the clinical component of a seizure occurs from time to time with or without an electrical correlate in neonatals and called by them electroclinical dissociation, can be called neonatals electroclinical dissociation, in short, neonatals ECD. And the phenomenon described above, when the appointment of anti-epileptic drugs is accompanied by an improvement in the electroencephalographic picture, but with a worsening of the clinic and an increase in seizures, and the change of the drugs leads to the opposite result, an improvement in the clinical and deterioration of the electroencephalographic picture, and called earlier by us clinical electroencephalographic dissociation. One can call drug electroclinical dissociation, in short, drug ECD. But since the word drug is often associated with drug addiction, we can use the word medication instead of the word drug. And the term will sound like this: medication electroclinical dissociation, in short, medication ECD. While reviewing forced normalization and aggravation of epilepsy as a result of anti-epileptic drugs administration in connection with each other, it should be noted that in the overwhelming majority of cases of epilepsy aggravation, normalization of EEG is not observed, while in case of is noted which of these which is evidenced by the fact that patients unaware of forced normalization of EEG often discontinue administration of anticonvulsants and provoke seizure in order to improve their condition. From this perspective, it is possible to agree with some authors regarding forced normalization being one of the demonstration of epilepsy aggravation. In addition, this phenomenon may be viewed as electroclinical dissociation, as improvements in electroencephalography and deterioration of clinical picture is observed. And we can specify the name of this type of electroclinical dissociation: forced electroclinical dissociation, shortly forced ECD. Cases of forced normalization in migraine are described when, upon achieving remission and stopping episodic migraine attacks, it is accompanied by psychiatric behavioral disorders. It must be thought that the forced normalization occurred in migraine patients whose attacks are accompanied by an aura. During remission, there is an accumulation of psychogenic substances that cause an aura. Since due to remissions, they are not consumed during attacks, which leads to mental disorders of behavior. Now let's consider the importance of blood-brain barrier disorders in the development of epilepsy mental diseases. The blood-brain barrier may play a significant role in the development of epilepsy. The literature contains descriptions of the blood-brain barrier disorders in these diseases. There is a large gradient of glutamate in the blood in relation to the cerebrospinal fluid. There is much more it in the blood. A violation of the blood-brain barrier and an increase in the concentration of glutamate in the cerebrospinal fluid can cause an attack and the development of epilepsy. Violation of the blood-brain barrier can genetically determined and be acquired, caused by trauma, stroke, etc. Depending on the duration, it can be permanent, temporary, and possibly paroxysmal. For example, in response to paroxysmal change in the concentration of certain substances in the blood or brain. It can be general or selective in relation to certain epileptogenic or psychogenic substances. Why psychogenic? Psychogenic because the toxic psychopathogenic effects of blood serum of a patient with schizophrenia is known when administered to experimental animals. Their behavior after that changed. In favor of finding psychopathogenic substances in the blood is evidenced by the positive therapeutic effect of plasmapheresis in mentally ill patients. So, a violation of the blood-brain barrier in relation to psychogenic substances can also cause mental paroxysm and mental illness. Probably the psychogenicity and epileptogenicity of not all substances blood components have been established, and not all their gradients from blood to cerebrospinal fluid have been established. Therefore, it seems that a search in all these directions can lead to interesting finds. It's also possible that under certain conditions, an increase of the blood-brain barrier permeability can play a positive role in the treatment of epilepsy and mental diseases. For example, in pathology, when there is an increase in the production of epileptogenic or psychopathogenic substances in the brain and cerebrospinal fluid, while their content in the blood is low, an increase in the blood-brain barrier permeability will make it possible to transfer their excess from the cerebrospinal fluid into the blood. If an increase in their content in the blood is not associated with pronounced side effects, but will help to neutralize them and remove them from the body. Thus, in addition to the anti-epileptic system of the brain, consisting of the caudate nucleus, cerebellum, lateral nuclei of the hypothalamus, and the caudal reticular nucleus of the pons, at this stage, one can also note that extracerebral anti-epileptic system consisting of the blood-brain barrier and hemostatic blood mechanisms. Or perhaps the blood-brain barrier can be attributed to the borderline anti-epileptic system and the homeostatic mechanism of blood to the extracerebral. In addition, as can be seen, the blood-brain barrier and blood homeostatic mechanisms are also an extracerebral antipsychotic system. Since they are the sonogenetic functioning can reduce the severity of psychopathology or prevent its manifestation. The search for brain structures that inhibit the action of psychopathogenic substances may lead to the formation of the concept of an antipsychotic system of the brain. It has been said about that the role of hormonal and immune systems in the development of epilepsy and mental diseases is established. and studies in this direction still continues. Recent intensive ongoing studies have shown that presence of the brain's own immune system. The immune functions of microglia is shown. The hormonal structures of the brain have long been established: hypothalamus, pituitary gland, and others. Then the cerebral, hormonal, and immune structures of the brain, depending on the pathogenetic or cyanogenetic role they perform, can be attributed both to the intracerebral epileptic or psychotic system and to the intracerebral anti-epileptic or antipsychotic system too. The same mechanisms can be considered in relation to psychogenic substances and related to the psychotic and psychopsychotic systems of the brain. Also, the same can be said about the extracerebral hormonal and immune structures. They can play the role of both an extracerebral epileptic or psychotic system and extracerebral anti-epileptic or antipsychotic system, depending on the role they play. New substances are being discovered. They are produced outside the brain in the human body and play a role in the development of the mental illness. For example, the association of amyloid protein produced by the liver with the development of neurodegenerative process and Alzheimer's disease in mice has been shown. Thank you very much for your attention.